I'm glad we're doing something similar as well. And I'm happy to answer any questions later about how to get involved as a medical student and as a junior doctor as well.
Thank you so much for your introduction. We also have with us Dr. Eleanor, if you would like to introduce yourself.
Hello, everyone. Firstly, thank you for having me speak. I feel like in terms of my journey in research, I'm at a much earlier stage than Said. So I've just graduated from Oxford University, and now I'm a foundation doctor in Bristol Royal Infirmary. I am an academic foundation doctor, which means that next year I have a period of 3 months dedicated to research. And to date, my research experience has been predominantly in neurosciences and neurosurgery. I'm not sure if that's the area I want to go into, but that's certainly where my research interests currently lie. And specifically, so throughout university, I looked at chronic pain models.
Thank you. Thank you for joining us. We also have with us Dr. Omar Safarini. You can go ahead and introduce yourself.
Hello, everyone. This is Omar Safarini. I'm a recently graduated physician. I finished my internship actually in July, so just a month ahead from my internship graduation. So I like working on research. I started working on research since my second year of college. I have more than 25 research contributions till now. I'm now focusing on working on radiology related research because I'm passionate about radiology, and I'm applying for residency in the US. I'm just gonna repeat what Dr. Said and others said about the current situation. It's always difficult to talk about research in terms of what we're going through in our country in general and in Gaza in specific. So I just hope everything becomes fine soon. Thanks for having me today.
Thank you, Omar. And congratulations. And I also echo what you both said in regards to research. We have our final speaker for today, Ragad Sweiti.
Okay, hello everyone. Thank you for organizing this session and thank you for having me with us today. I am Ragad Sweiti. I am a sixth-year medical student at Al-Quds University. My research interest started when I recognized how research is important for Palestinian doctors. Then it was like I improved my research skills by attending many lectures and then by joining the Medical Research Club as an administrative member and start to educate others and encourage other students to get involved in research, and then by practice my theoretical knowledge and doing research and also mentoring others. My research interest is in neurology and in medical education, but I'm working on diverse topics.
Thank you, Ragad. And thank you all. So we will start with the questions pre-submitted by the students. We have asked them to submit questions. We will start with those, and if we have more time, we can accept questions directly. So to make things more organized, feel free to speak and I will organize the questions and the chat. Look in the chat if we have any comments regarding the same question itself. So starting with the first question we have received, what opportunities do we have to participate in research papers? So the first question has two parts. The first one is about research papers and how to participate in them. And the second part is how do I obtain a research exchange? And it was not directed for one person only. So if anyone would like to answer, you can go ahead.
May I answer that?
Yes.
Okay, so I'm just gonna answer it briefly and give the microphone to Dr. Said. Basically, research is a long journey and it has many parts. So what anybody can do, according to what I believe, is that a case report is almost always available. and it's the easiest form of research. So if anybody is trying to begin his research journey, working on a case report won't take a lot of time and doesn't even need any experience, because you just need to organize the data that you already have in your hospital. So it doesn't need anything from any person working on that except some time, and even very very small amount of time. That would be the first step for anybody looking to work on a research project. The other step, and the main step that it needs a lot of time in comparison to working on a case report, is to learn how to conduct research papers and be knowledgeable with the statistical tests. Not to be a guru in statistics, but just learn the basics of that. That maybe every research might need. Let's say the frequencies, the p-value. What does a p-value mean? The very basics of these stuff. I guess that's the main things that anybody who's looking to work in research should concentrate on.
Thank you.
I can go next if nobody wanna answer. So I mean, to do research, the first thing is to have a research question, and that comes from, you know, for example, if you're in a clinical rotation, surgery, medicine, etc., and you see a complex situation, or just an idea came to your mind about how to best manage. Let's say we're in a genocide situation, and you do wanna know more about like how to manage how to manage limb injuries, and how to do limb reconstruction, all of that, and how to report the injuries that are happening. So that's a question that you have. The second step is to look at the literature and see if there's anything that has been reported in that similar situation in other war situation. And then after that, then to kind of form a group and work on a research protocol and get started, and obviously the ethical approval. So that's just to simplify things. Now, you know, Omar mentioned that, you know, case report is a great start. I agree. It doesn't have to be a randomized clinical trial to do research. That's something, of course, everybody aims for, and it's on the top of the pyramids, and including meta-analysis and all of that. But start simple, start something easy. It doesn't have to be groundbreaking. Case report, it's definitely important, but I would also caution people about doing a lot of case reports and just having a CV full of case reports, because many journals have moved away from case reports, and in fact, it's no longer on the kind of articles that they would accept. And so it's good start to know how to write it, but a lot of journals just don't accept it. The other thing you could do is, you know, review articles, whether it's systematic or non-systematic kind of review articles or narrative reviews. You know, case series, like retrospective, prospective studies. There is a lot of studies you could do. But really the biggest thing, the one that I learned with the few publication I've done and projects I worked on, is to formulate the research questions. And a good research questions gives you a good paper. That's what I think. Now, research exchange, I don't know what that means. Does that mean to kind of go outside the country and participate in a research project? If so, you know, the opportunities that I come across, they are limited in terms of doing research outside the country as a medical student. There is what we call in the US pre-doctoral research fellowship, which basically before finishing your Doctor of Medicine or MD, you could come for a few month or two to do a research project. The biggest program is at Johns Hopkins, where you can come for a research elective. But you know, you could come to any university and do a research project. You just have to contact a PI or a principal investigator and ask if you can come and join. Unfortunately, most of these programs are unpaid, and you know, quite frankly, you're going there to learn, so you shouldn't expect to get paid. There are some scholarships you can apply for too, but just a heads up, it won't be paid. You'll have to pay for it. At least your expenses like travel and accommodation, all of that. I don't know if that answers the question.
Yes, thank you. And also, Ragad, if you want to add something, since you maybe know more also about opportunities for medical students.
Yes, sure. First of all, as Dr. Omar said, you need to learn at least the basics of research methodology and statistics before you start searching for research opportunities. Then you can just build connections with researchers at your community, like your doctors at the hospital or teaching staff at your university, and just show your interest and ask them to provide you with research opportunities. Or you can join student associations or organizations that provide research opportunities for medical students at your university or other universities. And preferably you can create the opportunity by yourself by reading the literature and brainstorm for ideas, and then find a mentor to guide you throughout the process.
Can I add something as well? I think Asaid's point and like around research questions is very important. I think it's important to have, before you reach out to supervisors, have an idea of something that you'd like to do. Don't just go to them and say, like, I want to get involved in research. You need to be specific either with the topic or with the skill set that you want to develop. So if you want to develop skills in like secondary research, so scoping reviews and systematic reviews, go to them and say, like, I want experience with this in this topic, or go to them and say, like, I want experience with like quantitative research. So that would be the primary form of research. So have an idea of firstly what skills you want to gain, and secondly, like the rough topic area. It's understandable as a medical student that you might not have an idea of like the exact research question, and it might feel like overwhelming and challenging to be able to approach a supervisor with an exact question. From my experience, I did a systematic review looking at the causes of pediatric hydrocephalus in different regions in Asia, and then like looked at the association between things like the temperature of the region and the socioeconomic income of the region, and related to that to the causes of hydrocephalus. And that was not a question that I came up with myself. I emailed a supervisor and I said to them, look, I'm interested in hydrocephalus in children. I'm also interested in like the potential different types of treatment of hydrocephalus. And they basically got back to me and said, look, there's already lots in the literature about this. I'd recommend doing this instead. But ultimately, I went to them with an idea of what I wanted to do to start with. So it looks like you've done some reading, but you don't need to know like the exact question which you want to answer, because your supervisor will be able to provide that.
Thank you. The next question we have kind of asks about how long does it take to complete a research from literature reviews to publishing, and I assume this will be after someone has like a research question or a topic they are interested in. And again, also this question is not directed to someone in specific.
I can answer. I mean, it really depends. It could take you a few days to a few years. So it's I don't know. It depends. If you're doing a case report and it's just one patient and it's simple thing and all of that, then it's easy. Of course, the challenge is getting it published. As I said, like case reports, either if you get lucky and you have an easy to publish decent journal that accepted, then yes. But if you're doing a clinical trial and you need to recruit 1,000 patients, and it takes forever to finish the project, and it takes also a lot of time if you want to publish in a good journal as well. So it really takes, from my own experience, I think the shortest publication was within a month. Project from start to finish, including publication, which was, unexpected, but the longest it took me was 3 years to get things done, especially if you're doing something remote and, you're working with clinicians who are super busy. So it really depends.
Yes, thank you. Does anyone want to add to this question?
So with
Okay, we will go with Ragad.
I
and
agree with the
then-
say that it's very variable, depending on what you're involved with. Often with things like RCTs, you're not going to be leading that realistically. That's going to be your senior who will be the one leading it. And that is going to take years. They don't happen quickly. It takes a long time for ethics boards to go through. Yes, whereas things like secondary research, so systematic reviews, scoping reviews, can be done a lot quicker. So I turned mine around from like setting up the question to having a publication and a conference, like an oral presentation at a conference in a year. So, and I did that during like alongside medical studies in medical school. So it is doable like within a year to turn a systematic review around and get it into a good journal. Whereas I think often primary research, because you're dependent on data, like having the data there or collecting the data, it takes a lot longer. And if you're happy to be patient and like ultimately you have a question which you want to answer and you want to take the time to do that, then expect it to take years, like more than 1 year.
Mhm. Ragad, you can go ahead.
Yes. Okay, so from my humble experience, other than the study design, it also depends on the team that you are working with, whether the team is interested in what they are doing or passionate and dedicate enough time to the work or not. It also depends on the supervisor, whether it's responsive or not. And in Palestine, the data collection process is actually challenging, especially if it's from the hospitals, and all that counts to the time needed for completion of a research project.
Mhm. Thank you.
I would just like to add a comment just for the attendees. I know, believe it or not, but RCTs are not allowed in Palestine. So, so if anybody is trying just to have an idea for an RCT, just be aware that they are not allowed in Palestine. Yeah, and there is a conviction crime for that. 5 years, I guess, in prison with 5,000 Jordanian dinars, something like that. I'm not sure about the exact things. But what I'm sure about is that it's prohibited in Palestine. And a lot of efforts have been done to overcome this thing. But I guess the Palestinian population are not that much ready to accept the idea of RCT.
Thank you, Omar, for this information. I'm pretty sure a lot of people didn't know about that. So for the next question, I think maybe it could be directed to Omar and Ragad. So the next question is, what is the best type of research to conduct as a basic medical student, since you started your research journey since you were basic medical students until now? For example, microbiology-oriented research or more clinical case-oriented research?
Okay, I think for clinical oriented research, I think cross-sectional studies will be a good start, and they are easy and does not require a lot of time.
According to me, it depends on everybody's objectives and goals. If I'm gonna concentrate on basic research, that's an option for any doctor. But I would do that if I'm aiming to have a more academic field in the future, not just trying to specialize in something clinical. If I'm gonna think clinically and I want to specialize, let's say in the US or UK, whatever, I would concentrate on the specialty, if I know, on the specialty I would like to specialize in, because that would give me a privilege over other people, since I'm showing dedication to the specialty I'm working on or I'm applying for. And this would even help me make some connections with people that might apparently help me in my journey. I just want to add another thing. I'm sorry, I'm adding a lot of things. Regarding the Johns Hopkins research program, there is a virtual program that we can apply for, and it's free. I applied for that maybe 3 years ago. I guess that it was during the COVID-19 era, so I'm not sure if anybody even looked at my application, but they sent me an email maybe a year later, and they told me that I'm not accepted. They didn't even tell me anything about the reasons for that. But I guess it would be a good chance for people. I don't know if it's still working, but maybe you can just try it, and maybe you can have an opportunity online working with Johns Hopkins and for free. Just search for that, right? Johns Hopkins virtual research opportunities.
Mhm. Thank you. You mentioned like maybe if you want to specialize in a specific field, your research projects could be in the same field. We actually have a question about this, and it's directed to everyone. Someone asked, if I want to specialize in a specific field, do my research projects have to be in the same field? If someone has an experience in that.
Okay, okay, Dr. Said, you have the lead.
Go ahead, Omar.
Okay, you can start. Okay, I can just follow after you.
Sure. Okay. So, I mean, as a medical student, it really doesn't matter, in my opinion. Like, whatever you have, and things change with time. Like, you know, if you're a first-year medical student, your interests will for sure change as a, you know, sixth year or fifth year medical student. So it doesn't matter. Whatever you have, whatever opportunities, just take it. When I was a medical student, I had the thought that, oh, well, it has to be, I always wanted to be a surgeon, but, you know, my thought process initially it was like, you know, since I want to do surgery, then I have to focus all of my efforts on surgery. But I was wrong because, you know, the research mentors in surgery during my time were, you know, the number was very limited, and the mentorship I did not have at that time. But most of the research was done at that time, and the opportunities I had were in internal medicine. So I took some research projects, and you know, eventually, and I did them. And so that's my advice, especially in junior years, like, you know, first to, let's say, fourth year, just do whatever you want, whatever opportunities you have. When you know for sure you want to do surgery or medicine or any specific field, then my advice is to tailor your projects to the area you wanted to specialize in, for two reasons. Because the more you do projects in that specific area, the more you're going to explore the subspecialties within that area, and you're going to know more about the field. And then second of all, when you apply, especially in the US, or I would say Western European countries and the UK as well, they wanted to see that you have interest in that field and you achieved certain things and you went to big meetings in that field. And so really, when you become more senior, you have to tailor your projects. Now, I've seen people who have done research in HIV and TB and all of that and still matched in surgery, but those are exceptions. And especially if you're doing like a NIH grant or like going for a big like master or PhD, whatever, then you're just establishing your academic career, so people won't specifically look into the specific topics. But in general, my advice, just try to tailor it. The more senior you are, the closer you are to applying for that specialty.
Thank you. Omar, you can go ahead.
I agree with Dr. Said 100%, 1000%. But I also have a suggestion for those people. I do believe that since we have some scarcity of research opportunities in Palestine, I would recommend if anybody has an opportunity for research, they should just go with it, because we don't have that much variety of research opportunities. And even specifically talking about mentors, we don't have mentorship programs in Palestine. There is a mentorship program that was started, I guess recently, maybe in 1 year. I don't know how did that go. Dr. Said, I guess, was one of the mentors. But we're still having some initiatives and we're working on that, but we need some time to get things done, at least. So my advice is whenever you have an opportunity, whether it's basic or clinical research, you can just start off and just try to learn anything from that opportunity, even if this is not the thing that you're gonna specialize with. Talking about myself, the first 2 research papers I published were pure literature review articles. So literature review articles are not significant. They are not something related to any specialty. But believe or not, these 2 articles are one of the top cited articles I got, because literature review articles are used a lot in a lot of research papers and cited a lot. And having some citations would give you a privilege over others, because you are excelling in your field. And I'm gonna add something that maybe not all of us knows. In the US, if you have some significant contributions in research, you can apply for something called National Interest Waiver and get a green card just based on your research papers. And this would significantly boost your chances in getting a residency or whatever you want at the US. So it needs some specific stuff, but generally, let's say that it needs good quantity of research papers and good citation records. If you got these 2, you have very good chances to apply for a green card and get these get this thing, and that would help you a lot. Nimr Adib is one of the doctors who graduated from my university, Najaf University, and he did the same thing. He's now, I guess he recently graduated or finished his residency in neurosurgery. So just imagine that this thing helped one of the doctors to specialize in neurosurgery as an IMG, which is basically almost impossible.
Thank you, Omar. If anyone wants to add anything to this question before going to the next one.
Omar, that's amazing information. I'm also learning new things. I think I agree with everything Asaid and Omar have said. I think initially, particularly when you're starting out as a medical student, you might actually not know what you want to do. So if you just focus on the skills which you want to develop, and even then later when you're submitting applications, you can then sell yourself on the skills you've developed. And then as you move through medical school, you'll gain more clinical experience. And then moving into training, you'll also gain some more experience and you'll be able to start tailoring. But when you first start out, just focus on the skill sets you're developing, because then when you approach people in the future for research, you can sell yourself based on those skill sets, and you're more able to like tailor the projects you're doing because you have that foundational skill set there.
And if I can add to Eleanor, exactly. I mean, it's when I was applying for surgery, one of my mentors said that what matters is at least have a first author publication that showed that you've done a significant work, you learned a lot from it, you developed leadership skills by working with others and managing your research group. So that's the skill set is more important than like the number and the and of course being the first author. Always your goal is to be a first author, always your goal is to get things published, and so that's what matters. And then the exact topic, the like which specific journal, that's like secondary thing, and we shouldn't care much about it, especially being a junior, like a medical student or junior doctor.
Mm-hmm. Thank you all for
Just
your
going to bounce off
answers.
that one more time. You need to imagine that someone asks you in an interview exactly what you've done, and you can actually like list exactly what you've done and be very specific with what you've done. So that's what you should be aiming for when you're getting involved.
Mm-hmm. Okay, thank you. So we have one question about like when starting with your research, you might encounter financial problems. Like how can you convince the government or have any medical assistance to invest in your experiments? Or if it's something that is a problem when starting research?
mean, I don't know if anybody got funding from the government. That's especially in Palestine. I mean, they don't have money. So I don't know. I mean, my funding was from the scholarship that I got during my master's, and some like smaller grants. But if you come from a rich country, then yes, they may have funding. They may have funding in the specifics depends on the grants. So that's just my.
If somebody really needs some funding, they might just apply to some international grants. That's the only option I see, because as Dr. Said said, we don't give monies. Our salaries even are not given to us. So just imagine our salaries are not given to us. So how can they just give us a grant? Some NIH programs have grants and can support even in millions. So, but it just needs a very good proposal and a grant writing techniques, and people can somehow secure. But I guess we still need some experience with that. I'm not sure if anybody in Palestine has ever got this thing, but it's just an option.
Mhm. Okay. So we will go with the question directed to Dr. Usaid. It's in the chat. How long does it take to get into a surgical residency program, and how much research experience is required?
I mean, maybe the question is not super relevant to the topic today, but I'm happy to answer it. I mean, it depends. My advice, if you wanna apply for especially a competitive specialty that has the risk of being in a prelim spot, which is basically an experimental year, I would work really hard to avoid that and try to get what we call categorical, which is a full 5-year program, which requires to do research in addition to doing the USMLE. So USMLE have step 1, step 2, and step 2 CS is no longer there. So you have step 3, which is not required to applying, but it's preferable to have it. And then once you're ECFMG certified, then you can apply. But you really need to do a research year, at least in my opinion, in the US. And basically that's what we call postdoctoral research fellowship, where you are working with a PI or principal investigator on a specific area or specific field, and then your goal is to try to publish as many papers as you can. That's the difference actually that I noticed between the UK and the US. They care more about numbers. In the US, in the UK, they don't care as much, and they care more about quality. And of course, it depends on the lab, but at least my experience in Oxford compared to my experience in the US, it's a number game in the US, especially applying for surgical residency programs. And then you need the support from your mentor, having a good mentor support you and make phone calls for you. Again, it's just a different process than the UK. The UK is a more fair system, point-based system. The US is more like connections and more of like numbers of everything, publications, conference presentation, all of that. For me, it took me 4 years. So I took the unusual pathway, and I call it, like, I did a research residency before starting actual residency. But it could be shorter for sure. I mean, I've seen people doing 2 years and 1 year sometimes and still match. For me, it was different because coming from Gaza, I didn't have the money. I didn't have I didn't take my steps. All of my journey, like actual journey, like being serious about it and taking the steps, started after finishing intern year. So the sooner you start, the sooner you get things done, the better, and you have higher chance of matching. So.
Thank you for that. And Yes, I am seeing the questions in the chat, but first I will go with the ones we have received prior to the session. So the next question is also directed to everyone. How do I ensure that my research is original and to avoid plagiarism? They are making it like they are explaining it, how to not get into trouble for having some of the same ideas as previous research.
Okay, so before you start formulating your idea, you need to do a comprehensive literature review. From that, you know whether this research idea has been done before or not. For the plagiarism, after you completed writing sections of your manuscript or the whole manuscript, there are a lot of plagiarism checkers that you could use.
Also, adding on to that, even if your research question is similar to a previous research question, you've got a new data set. So like the inset gain from the data set you have might be like something new. So particularly if it's clinical, so say you're looking at, I don't know, the development of pain in patients who have a certain type of surgery, like if you've got a cohort of patients in the UK and a cohort of patients in Palestine, like that's different research. And like ultimately all of the different studies that are done are all going to contribute to what a systematic review that will in the future be conducted. So like your research question doesn't need to be like completely groundbreaking or unique because you're going to have unique data. In terms of plagiarism, I think ultimately if you cite what you're saying, then you're not plagiarizing. Yeah.
I can answer that question too. So I agree with everybody. I mean, the thing is, there's a difference between replication of a study and plagiarism. So replication is actually encouraged to replicate that research idea in a different setting, a different patient population. In fact, a good research is a research that you can replicate because the methods are clear, everything is clear, there's transparency in reporting. That's why we have reporting guidelines on how to write a paper, how to report like the methods and all of that. So doing the exact same study is fine, as long as you cite that paper that you followed the methods and you basically try to make it different in terms of, you know, methods can stay the same, but like make it a different population, different, maybe slightly different research questions. It's okay as long as you acknowledge the people. Now, the term plagiarism refers to more specifically to writing. When you steal somebody's effort by like taking an exact paragraph and putting it in the manuscript, that's not okay. Now, to avoid plagiarism, especially for somebody like myself, like most of the audience, we're not native English speakers, is to avoid copy paste. The way I was taught, actually at Oxford, is that you look at the paragraph and then you try to summarize what you understood from it, and then you cite it, rather than copying it and paraphrasing. Paraphrasing is not okay. You should not do paraphrasing by like moving words. It's still the most of the journals, they use a software. There's so many of them, but a software that compare the text that you wrote or copied and then compare it to the literature. And that those softwares, they have access to most papers, even if they are like closed access, they're not open access, and they can detect. And it depends on the percentage. If there's more similarity, what we call similarity report, if there's more 10 to 30%, depends on the journal, then they're gonna flag it. And they either gonna ask you to change it or they may take legal actions. So especially if you are submitting to big journals. So in general, avoid copy paste, just try to write what you understood from it and give the credit by citing. And citation is essentially you're putting the reference, putting a reference number next to the article, the paragraph you wrote, and then you put it in the reference list. So it is definitely hard, and I went through that phase as a junior researcher initially, and it was super hard learning like the academic language and academic writing and all of that. It's super hard. It takes a lot of time, but very, very basic advice. Just don't copy paste.
Thank you. Thank you all for answering this question. And so we will go to the next one. And I think we have two questions and they are kind of related to each other. So the first one is, how can I find high quality research? And the next one is, what is the impact factor of a research paper? And what is the H index? So I think we can discuss this topic together if someone wants to answer. It's also directed to everyone.
I can answer that if nobody minds. Okay, so there's something called impact factor and there's something called H index. There are two different definitions for these things. The H index is it's like a rating for the research scholar. So anybody working on research, there's an automatic let's say evaluation for the quality of the research papers that this researcher is publishing about. And this is calculated in a specific way. According to what I remember, it depends on the quantity of research papers and the average that each paper is cited. So let's say that someone have let's say 10 research papers published, and in each research paper there are 3 citations. So the H index at that moment would be 3. So that's the H index, and whenever it becomes higher, this gives anybody looking at that profile an impression that this researcher is well reputed in their field, and they are having some high quality research papers, just depending on the number of citations that they got. Regarding the impact factor is something that is somehow similar to the H index, but it's related more to journals. So to look at the journals and let's say choose which journal that is stronger in terms of citations, an impact factor would give you a good impression about each journal. So a journal that has a high impact factor means that this journal have high average of citations for each research papers that is published in each issue or volume of that journal. So I don't want to make things look complicated, but it's just about how much cited an article is, whether it's for a journal. So if it's for the journal, it's called an impact factor. If it's for the researcher themselves, it's called H index. And whenever it's higher, it gives a clue that the thing that you're looking at is of a good quality. But sometimes you should be aware that it doesn't always reflect good quality, because let's say some predatory journals, and predatory means journals that are publishing every single research paper without even peer reviewing it, would have high citation numbers, which would obviously make them have high impact factors, while a lot of the research papers are meaningless. So we should be aware that having a high impact factor does not necessarily mean that the journal is the best. That's my opinion.
Thank you. I'm pretty sure you explained it very well. So if we don't have any other comments on this question, I can go ahead with the next one. Okay. So we have a question in the chat. So maybe you can help with that. Salma asks, how can we find online research groups? What are they? And if it's valuable for the medical students?
I can answer that. I mean, I know it's getting more popular these days. Like there is some Facebook groups where they do like a lot of systematic reviews, basically note that I have not been involved in those kind of groups. I think that's probably the question that it kind of relates to, but there is like something called that I'm more familiar with global surgery or global health projects where you have a collaborative model. A research is based in the UK mostly, and it's very popular in the UK compared to other countries. And then they want to do an international study and they look for collaboration. The big project was Global Surge, for example. There was 1, 2, and 3. There is COVID Surge as well. There is STAR Surge that is across the UK and Eurosurge across Europe. They look all the time for international collaborators, and you can be a research lead. I was the research lead for Palestine for Global Surge 2 and 3. And then through that, we form a group, like usually WhatsApp or Facebook group, and then you do a study. I also ran a Scalpel 1 and 2 project, and we formed a group. Usually just look at like online, having online presence, like, you know, whether it's Facebook or Twitter, especially Twitter, I would say it's important to connect with the academic world and see what opportunities are there. It's important. So really just whatever you see on your timeline and you kind of like apply for those opportunities. Now there is, as Omar said, there is some, especially after COVID, there is some universities, they look for virtual or remote research fellowship. They are okay, they're good, but they're not the best. My advice, if you can travel to that country and do research there, is so much better because you get that face-to-face interaction with a mentor. You get to attend workshops and courses. You get a certificate at the end of it. So the experience is different, especially if you're doing like a master's degree or a kind of a degree, research degree. I think that's the way to go. But like doing it remotely is so different. I've done both and I can tell it's so different. So your goal is to do it in person.
Okay, thank you.
I would stress on the fact that Twitter has a lot of things to be shared on. I personally worked with someone who I never met. He was a program director for radiology in the US, and I published a paper with him just from my home. I was working on a research paper with him. So I do believe I even used LinkedIn, but I didn't feel that LinkedIn was as useful as Twitter. So the most useful platform, depending on what I just had an experience with, X or Twitter, whatever you would like to call, is the best.
I also think for researchers in the UK and doctors in the UK, from my experience, they use Twitter less. They more use email. So if you're reaching out to a doctor in the UK, email them, don't use Twitter. And then for the US, use Twitter.
Yeah, the British are more formal. No, I agree. I mean, it's using email is the way to go. Things have slightly changed, I would say, with COVID. There are people who are okay with Twitter or whatever, LinkedIn. There are people who are not okay. I think to be in the safe side, emailing is the way to go. I agree.
I just want to mention something. I didn't mean to reach out to doctors using these platforms. I just meant that there are some opportunities that are posted on these platforms, so you can reach out after looking or seeing that opportunity using email. I do not ever recommend reaching out to a mentor or whoever using unofficial platforms. We can always start by an email, and if the email wasn't responded to, maybe we can try other platforms. But according to me, it's always the best to reach out through email.
Yes, and I see a lot of researchers post on LinkedIn, like they call for participants to participate in research opportunities but I don't really know if they are reliable or not. Also, if you are interested in a specialty, you can join international associations. For example, I'm interested in neurology, so I joined the American Association of Neurology, AAN, and became a member. There are a place for students like to chat and to communicate their ideas and like to plan for research projects.
Thank you, Ragad, and thank you everyone for your answer. Now I will give the chance if anyone has a question to ask now. Like you can raise your hand and open the mic and ask your question. Okay, I think maybe if you are thinking about your question, we can go ahead and ask our speakers. What advice would you like to give to a medical student wanting to start out in research? We can conclude with this if no one has any other questions.
I can go. So I mean, the biggest advice is to try to work on research early on, especially if you're interested in research. If you're not interested in research, that's something that I learned kind of along the years. You don't necessarily have to do research. If you're really interested and you have passion about it, do it. If you don't, that's fine. Even if you want to get into residency, you can still get into residency without research. Obviously, if you're applying for competitive specialty, then you have to. But like, don't just waste your time by doing a lot of paper while you're not interested and you're just having that pressure. That's my advice. The second thing is try to find good mentors, and it's super hard to find back home, talking from an experience. So if you think you want to be an academic physician, which is basically you're good, like or you're doing clinical work and you're also doing some research and teaching, all of that, my advice is to do a degree. It could be as short as a master's degree because it's more of a structured program. You get to learn the basics. You are a full-time researcher and all of that. Or the more of like the US model, which is a postdoctoral research fellowship, or a master of public health, which can be done in the US or the UK or other countries. That's in case you really wanted to do it. And I've done it myself because I want to be an academic physician. So I've done both. I've done masters, I've done postdoc, I've done also research fellowship in the UK as well. So the other thing, which is related to what's going on right now, the literature does not have a lot of papers about specifically about the pattern of injuries that are resulting from the ongoing aggressions in Gaza and West Bank. So, even if you're not interested in trauma surgery and all of that, but reporting about what's going on, reporting the humanitarian aspect of it, reporting about the casualties that are resulting from airstrikes or from like drone attacks or any military violence in Gaza and West Bank is super, super important. And it could be as simple as case series, could be as simple as, a opinion piece or correspondence or letter to the editor. Super important to show what's going on and show opinions even from medical students. For example, it could be as simple as like writing a small article, like just a narrative description of what medical students are going through currently in Gaza and West Bank and submitting it. It could be more powerful than a randomized clinical trial. And the literature is unfortunately absent, doesn't have a lot of voices from the people who are on the ground. So that's my last advice for you guys.
Thank you so much for your advice, and I think it's really important to start the research ourselves on topics that we find are lacking internationally. Does anyone want to give any advice?
I think I'm gonna find it hard to follow. So
Yeah,
after that
I'm
advice, I think the thing I would add is that if you do get your foot in the door with something, put like everything into it, like really prove yourself to, if you end up with a good supervisor, like be so proactive and so keen and like make sure everything you do is high quality and like prove to them that they should work with you in the future. So if you make sure that everything you do is high quality and you impress everyone who is your supervisor, more opportunities will present themselves, like they will keep coming up if you are always like proactive and hardworking and make sure that what you produce is high quality when you do get your foot in the door.
My advice is to grab whatever opportunities comes to the person, no matter what field is that, who's the advisor, who's the mentor for that. Just grab as much opportunities as anybody can, because you never know which opportunity would really make the transformation of your career. So always try to give your best shots for everything. And I'm gonna quote a Quran verse that says, وَأَنْ لَيْسَ لِلْإِنسَانِ إِلَّا مَا سَعَى. So whatever you give effort for, you're gonna get it back. So just try as hard as you can. And best wishes to everyone.
I also want to add that I think a researcher should be passionate about what he is doing and able to dedicate enough time for it. Also, you should form a team and find a mentor and supervisor that you trust and able to guide you throughout the process. Also, there is a lot of space to work on epidemiological studies here in Palestine. There aren't many studies that focus on epidemiological data. So you can like make this point the point where you start.
Can I just add one last point to echo Ilnor's point? Commitment is super important. So if you want to be part of a project, especially be like a first author or second author, whatever, you have to be committed, which means, for example, if your supervisor gives you a deadline of 2 weeks, don't just ignore that and just like get it done in 6 months. That's not okay. Try to even when somebody gives you a 2 week, get it done in a week. And that's hard because you have to work really hard. You have sometimes to sleep late to get it done because academia is not, there is a lot of deadlines, especially if there is like funding and like you have to get things done really fast. Just get it done as soon as you can. And using email is super important. Like not checking your emails and like finding out that I missed the deadline is not okay too. Unfortunately, most of the students, talking from my experience as a medical student back home, I think I created an email like after third year. And because it's not the culture back home is to use Facebook for everything. But using email, like creating your email and making it professional, knowing how to respond to emails in a professional manner, responding to emails in a timely fashion is super important. And this way, and the one thing that I wanted to mention, being a good clinician doesn't necessarily mean you're a good researcher, and the other way around, being a good researcher doesn't mean you're a good clinician. To be good in both, which is super hard, you have to work really hard, and you have to meet deadlines. You have to just kind of get things done rather than just delaying things and finishing a project in 10 years instead of like 10 months, something like that. So it's hard.
Thank you all for your advice, and thank you for joining us today in this discussion. Despite all what has been happening and is still happening, I would also like to thank our participants, and we have sent the feedback form in the chat. Please don't forget to fill the form as soon as possible. And again, I would like to thank you all for joining us today, and for sending also your emails. I think this is the best motivation to have the students check their emails and use them properly.
Thank you, Veronica. Take care.
Thank you.
Thank you for hosting, Batul. Thanks, everyone.
Thank you for your efforts, Batul and all.
Thank
Yeah,
you, everyone.
thank you, everyone. Best wishes in everybody's endeavors.